Hey Refam, my name's Kate and welcome back to Keeping It Real, the podcast that's back again. We often have patients coming in complaining about back fat, and quite a lot of the time it's actually not back fat at all, but an excess of loose skin that has become uncomfortable and cumbersome under their clothes. Today, Richard and Kim chat about the best surgeries to address problems on the back, if liposuction alone can be a good solution, and whether CoolSculpting is just a waste of money or not. As always, please chuck our little podcast a 5-star review and share it with somebody that you think would enjoy a peek into the world of plastic surgery. Patients often come to see us distressed about back fat, but that doesn't necessarily mean that that's what it is. I think a lot of the time it is loose skin more than back fat, but that's what they're coming for, so let's answer. Are there certain demographics who are more prone to have back fat or loose skin on their back?
No, I wouldn't say a demographic, not that I'm aware of, but definitely the massive weight loss patients are more prone to have loose skin, and you divide that up into the upper back and lower back. Very rare that someone would have just upper back loose skin and not lower back loose skin. A lower body lift or 360-degree tummy tuck will address the lower loose skin and fat if needed. And surprisingly, I tell patients it won't address the upper back, but surprisingly it does to a certain degree, particularly if there's a bit of fat there and we do some liposuction. But if it doesn't fully address it, there are a couple of options which I am sure will be part of a subsequent question.
Nice.
Yeah, sometimes patients come in for a breast reduction consult and will say to grab the back of their armpit and will say, will my breast reduction fix this? And no is the easy answer for that, because that's part of your back or the back part of your axilla. And when we assess you for a breast reduction in particular, always look at the sides, because if the breasts are very wide, they can go around the sides. And if the patient's then lost a lot of weight as well, then not uncommonly that skin kind of keeps going all the way around. And so similar to what Richard mentioned in a previous podcast, if someone's looking at you for a breast reduction and not looking at the sides and not identifying that you've got an issue on the sides and then also looking at the back if there's an issue there, then there may be areas that are of more concern. And I think a lot of women, your comment before about the bra, most women are not wearing the correct size bra. And so if the band is too tight, no matter whether you've got back fat or back skin or not, if your band is too tight, it's like a muffin top if your jeans are too tight. Like it's squeezing that tissue to hang over the top. So it doesn't necessarily always mean you need an operation to fix it. Maybe you just need a bra that's better fitted. And particularly those women with very, very large breasts tend to wear bras that are more poorly fitting or trying to get something that's tighter to hold them up more. And so it can be emphasising that skin to bulge over the top.
And obviously a lower body lift is 360. That's addressing the bottom part of your back. I guess twofold question. A, can you just get a back lift? Does anybody ever do that for just the lower? And then for an upper back lift, does that go the whole way around as well, or can that just be the back?
Both good questions. So the patients who would have a lower back lift without essentially a tummy tuck, they would generally be restricted to patients who have previously had a tummy tuck and they needed a body lift and then they've come to see us. Very, very rarely would I do just a lower back lift without a tummy tuck. But just recently we had a patient, she had a tummy tuck elsewhere years ago and that has held up okay, and now she wants a back lift. That's the much more common scenario. I don't think I've ever done an isolated back lift without addressing a tummy. With the upper back lift, it can be a standalone procedure, but again, that scar often extends into the inframammary fold of the breast. So if someone's having breast surgery at the same time, generally a breast reduction, I'll combine that with a breast reduction, because then the scar continues around from the back into the inframammary fold. You can definitely do it stand alone, but you want to plan the scar so it's ending in the fold.
Is it common for people who have a breast reduction to come back for an upper back lift?
Not common. Not with us, because
No.
I have had a couple of patients coming for consults that have had a breast reduction elsewhere, and they have had – there's someone I remember I saw towards the end of last year, and she'd had actually a dog ear scar revision on the side and was like, I'm still not happy. I've got excess. And I'm like, it just needs to go all the way around. And she actually wasn't accepting of that and wanted to have another failed operation, just a room's touch up, which I was not going to do because that's what her original surgeon had already done and hadn't fixed the problem. But generally we would assess them, and it's a very, very powerful operation in dealing with that excess skin on the side of the body.
Is the scar off-putting for people? Because obviously very similar scar to the lower body lift, but that one's kind of more hidden by underwear, whereas the upper back more looks like you've been sawed in half.
I'm fairly conservative in the patients that I'll do it in. So generally they've got so much loose skin in that upper back that they see the scar as being a reasonable trade-off for that. For the reasons you've said, it's not my favourite scar in the world, probably one above thigh reduction, because it is quite hard to get to land exactly in that bra strap. So the other name for it is a bra line back lift, because you're trying to keep it in the bra line, and as much as you try, it can be quite difficult to get it precisely in that position. But for the extreme patients, it's such a big problem that they're accepting of that scar. Then there's another group where there's not quite as much skin excess, and I've been in the last couple of years treating them more with an extended brachioplasty. So commonly they're wanting arms addressed as well. And so instead of having the brachioplasty scar end at the armpit, I extend that down into the inframammary fold, and then you can drag a lot of that loose skin from the back into that area that you're cutting out. And I tend to prefer that scar. And again, it blends down into the breast reduction scar, so I can often combine them as well, because then you can line everything up easily.
The results from that it's a really good.
Yeah, I think it's
scar.
been very,
It's
very
really,
effective.
Yeah, and they contouring on the side looks really good as well.
Thanks.
Yeah, that's nice.
Yeah. And then there's the group who have pretty good skin and they do really well with liposuction.
Is that a viable option for everybody that's coming to see you for these issues?
Never a generalisation for everybody. The back skin is quite different to skin on the rest of the body, and it's a lot thicker, sometimes even like 6, 7, 8 millimetres thick. And so it's quite resilient, and a lot of our patients, weight loss patients or general patients, have stretch marks throughout their body. It's very uncommon to see stretch marks, particularly on the upper back, because that skin is a lot thicker even than the lower back. So if there's a little bit of loose skin, not folds of it, and some fat there, then it can be an area that actually responds very, very well to liposuction on its own without having to remove the skin, because the skin is thicker and tougher, and it does tend to contract back in better than other areas, particularly if skin's stretch marked or thin, as for example the inner thigh, particularly in women, inner upper thigh. Terrible quality skin responds pretty poorly to liposuction on its own. Upper back skin often does really, really well.
What about that auxiliary section that you referred to before that some people have a lot of issues with? Would it be common maybe even to do a breast reduction and then
Very
lipo
common.
there?
I'd say do chest liposuction in a breast reduction in at least 20% of patients, maybe even more. It's not a huge amount, but it just, again, as Kim was saying, that skin in that area also is quite thick, so it shrinks down and conforms really nicely. And so unless they've got really obvious loose skin, and then we're not doing an extended brachioplasty, we're doing an extended breast reduction, so the scar extends onto the chest wall off the sort of foot plate of the breast, it usually responds very, very well to liposuction. So that roll of skin that hangs over the bra strap that Kim was referring to.
Other surgeons don't necessarily assess patients for this as well. I know we're talking about the back, but liposuction of a breast reduction on the side is that what's called the accessory axillary breast tissue. So again, if a woman's wearing a bra that's a bit tight and ill-fitted, they will get some skin and bulge at the front part of their armpit, but there is actually a condition where excess breast tissue can grow there. So it's normal to have some shape there, and particularly because you've got to be able to move your arm. So a little bit of loose skin with the arms at the side, normal. But if there's an extra kind of bulge of, sometimes it looks like a little golf ball, then that responds pretty well to liposuction as well. That can be done at the same time as a breast reduction to help smooth that bulge area out.
There's sometimes some loose skin with that as well, and I've occasionally actually had to cut it out, but I'll often treat it. I don't like to put a scar there, so I'll often treat it with liposuction first and just see if that is enough, and then you can come back and cut out some excess skin if you have to. But at least then the scar is easy to justify because you've done all you can without putting a scar, and so patients are then more accepting of having a scar there. And it's a scar that usually heals pretty well.
You start talking to them about the scar and it's like it's going to be the most visible, and when they come back I often actually forget to look at it because it remarkably heals very, very well, that scar.
What is the recovery like for both the upper back lift and the lower back lift? Are they similar?
Yeah, I'd say. So if you take the group of patients who've just had the back component of a 360, a lower body lift, and the upper back component, I usually would keep them in hospital just overnight. The recovery is pretty quick because that part of the body's not moving terribly much. And so uncomfortable for a couple of weeks and then gradually back doing more and more things, and then 6 weeks back to normal.
Lower back lift to an abdominoplasty delay their recovery, not so much. And similarly to upper back lift being added to a breast reduction, I don't think that necessarily delays their recovery anymore.
What about things like fat freezing?
Cryolipolysis.
What was the brand?
CoolSculpting.
CoolSculpting.
Is that ever an acceptable treatment option?
You're welcome to try it, and we're happy to see you after when it hasn't worked.
I don't know if I've ever seen a patient that's had it only on their back.
I haven't seen anyone.
Had abdo on arms, thighs.
I don't know if anyone in Australia is really doing it at all anymore.
Still driving around, you see the signs.
Oh, really? I haven't seen it.
Yeah, you just don't hang out with enough women that they're preying on.
Look, I think it's a very unpredictable technology. I think we've mentioned before, we did research it around about 10 years ago and seriously considered buying it, but just didn't think the results were predictable. And there's also this complication where they can actually grow more fat. Surgery works.
The patient population that it's most likely to work on, it costs the same as getting lipo.
I was just going to say, it's super expensive.
Which is the people that it would like, if you don't need surgery, then you like lipo is the option. So
I like to see the fat actually in the jar. I know I've taken it out.
I've always said that about you. Loves a fat jar.
Not doing TikTok videos of how much fat you've removed.
No, those days are gone.
How long do the
It's
results...
turning into the longest podcast ever.
Well, this is the last question. How long do the results from any of these surgeries last? Is it something they can expect to be around for a while?
Permanent, unless they change their body shape, then surgery works as opposed to...
Yeah, I usually give patients sort of a range of plus or minus 5 kilos. I think if you gain 5, lose 5, you're not going to lose any of the result. It might be a little bit more in some patients depending on your skin quality. But if you've got minor fluctuations in your weight, I don't think that's going to impact the result. The things we're worried about, obviously, if you put on a lot of weight, that'll stretch the skin. You might end up with loose skin again. If we've done liposuction and you've put on weight, we're not removing every single fat cell. Important to emphasize again, when we do liposuction, we take fat cells out, they're gone. You're born with a set number of fat cells. Fat cells don't multiply like skin does. They just engorge and shrink when you lose or gain weight, the other way around. But we're not taking every single fat cell. So there are still fat cells there that can get bigger. So if that gets bigger, the skin will stretch. And if you were maybe not at your ideal weight before and then you lose a whole lot of weight after, you might end up with loose skin. So stable weight after, as Kim's saying, should be a long-term result.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.